everybody, and welcome to this series of 10-minute interviews with Daphne Bryan. I'm Sergio Piesch, and Daphne has just joined me today from the UK.
The content of this interview is provided for information and education purposes only. You should consult your physician for advice on treatment, including supplements. Supplements may interact with other medicines and other health conditions. So please check with your doctor first.
So, Daphne, Parkinson's and the B1 therapy. This is the book you wrote on B1 therapy, and in a few months it has sold already over 3,000 copies. Could you tell me a little bit more about the book? Who did you have in mind when you wrote the book? Who is the book for?
I wrote the book primarily for people with Parkinson's who were searching for something they could do to help themselves. I've been telling people about the therapy ever since I'd realized that it had made such a significant improvement to my own symptoms. And I spent quite a bit of time answering people's questions about B1 on Facebook sites. Then one day, I had the idea that what people needed was a manual that clearly explained how the protocol worked and that people could refer to as often as they needed. Although, as I said, I wrote the book primarily for people with Parkinson and their caregivers, I also had health professionals in mind, and I included a section on the available research to provide the information that I thought they'd look for.
So a book as a manual. If I wanted to try B1 therapy today, how would the book help me?
The important thing to understand about this therapy is that it is not a one-size-fits-all. The dosage which brings symptom improvement differs from person to person, and someone wanting to try the therapy must be prepared for a little trial and error to find the right dose. So one very important chapter in the book is the one which describes the protocol in quite a lot of detail, giving advice on how to find the right dose and how you'll know when you've found it.
So the protocol, would you please elaborate more on the protocol?
First, you need to choose which form of B1 you're going to use. Then it's a good idea to make a record of your current symptoms so that you'll be able to recognize when they improve. I'd suggest making videos of you doing things like walking, talking, smiling, that you can compare with later videos. And you might keep a brief diary of how your symptoms feel each day. It's remarkably easy to forget, and it's remarkably easy not to notice when you're getting better. It was actually my friends who pointed out to me that I was moving and smiling better. Then there's dosage to consider. And the book suggests starting doses depending on the type of B1 you're using, how long to stay trialing each dosage level, how to recognize when you found the right dose, and how to recognize if the dose is too high.
Now, I've heard about the expression sweet spot. What is it, the sweet spot?
The sweet spot is the dose which triggers symptom improvement for a person. As I've already mentioned, this is not a therapy where everyone takes a certain dose and achieves the same results. Neither do we know much about how to predict what the right dose might be. It's possible that the heavier you are, the more B1 you'll need, and that the worse your current Parkinson's symptoms are, the more you'll need. But there are many other factors which affect dosage which we're not aware of yet. So basically, we all need to use trial and error. If the dose is too low, no symptom improvement is seen. If the dose is too high, you will experience overdose symptoms. These might be a feeling as if you've had too much coffee. You might feel edgy, or you may find you're not sleeping as well. or you may experience more stiffness or pain. Your walking might become harder, or handwriting might become more difficult. These overdose symptoms are more inconvenient than dangerous. We're not talking about a blue flashing light or a rush to A&E. And as long as you take a break from B1, the symptoms should ease in a day or so. It's important that when you have overdosed, you allow adequate time for thiamine levels to drop. And we suggest taking a break for 1 to 2 weeks. Then when you restart B1 after the break, you should restart on a lower dose. Some people are lucky and see improvements with the first dosage. Others find that they try several doses before they find the right one. One thing we do recommend is that when you're trialing a dose, you keep to the same dose for 4 to 6 weeks to give yourself time to notice if you have any improvements.
Let's talk about the routes of administration. Dr. Costantini started with intramuscular route injections and then shifted to oral route for those patients who could not get organized for injections. Are there any other routes than the intramuscular and the oral ones? And if so, what is the difference between them?
There are 4 different ways in which you can get the thiamine into your body at the moment. As you said, the oral dose is probably the most common. The advantage of using this method is that they're easily obtainable and you can get them as tablets, capsules, or powder. Intramuscular injections was the method used in research. This is probably the quickest acting method, but it's not always easy to find someone to administer them. Sublingual tablets are placed under the tongue, where they're absorbed through the mucous membrane and enter the bloodstream. This is a good method for anyone with issues over swallowing. However, they taste very bitter, and that's too much for some. Because the sublingual tablet doesn't go through the digestive system, which is where the oral tablet loses a lot of its potency, the sublingual doesn't need to be anywhere near as high a dosage as the oral tablets. And finally, a few people are trying patches, but I haven't heard enough yet to comment on their effectiveness.
Well, that's very interesting. So let's say if I started B1 therapy today, how long will it take me before I feel better? How would I know that I found the sweet spot?
You'll know when you found your sweet spot quite simply because you will feel better. You found the dose that's just enough to trigger symptom improvements. Some people experience improvements, but then increase the dose, thinking that they will produce more improvements. However, increasing the dose after you have experienced some improvements can often lead to overdose. You need to be patient. Improvements can be slow to appear, and some people talk about still noticing small improvements after 6 months on the same dose. The other problem is that it's sometimes difficult for us to notice changes in ourselves. For some reason, we notice when things become more difficult more than we notice when they become easier. This is why regular testing can give you an objective view of any changes. There's a Parkinson test called the pull test, which basically tests balance, and the tester stands behind you and puts their hands in front of your shoulders and gently gives you a jerk backwards. It's reckoned to be a good pull test when you only need 1 step to recover and rebalance. When you have a good pull test, you've found your right B1 dose.
Now, we are always concerned about safety. How safe is B1? Any side effects, interactions with other medicines, need to change current therapies, including levodopa? Many patients with Parkinson's are on levodopa treatment. How safe is B1?
B1, even in high doses, is safe, and literature on the subject doesn't mention any adverse thiamine-related effects, even at high doses or over very long periods of use. Thiamine can also be safely taken alongside other supplements or drugs. In fact, thiamine can even improve the efficacy of traditional Parkinson drugs. The one thing we suggest is that you don't change anything else in your regime while you're trying to find your right B1 dose, or it can be very difficult to know which addition or change has affected your symptoms.
Thank you very much, Daphne, for being with us. Your explanations are, as usual, very, very clear. Thank you all for listening. If you have any questions, please post them in the Facebook group on B1 therapy, and we will answer with Daphne in